So I'm asking actually the second passenger to board the train. This is Julia Kopanz. She is a PhD candidate at the Trials at Home project, and her focus was mainly around the patient and patient preferences. So actually, Julia consulted in her project over 700 patients and either talked to them in focus groups or consulted on their preferences in questionnaires. And I think she is really the one to give a good introduction into patient preferences on decentralized clinical trials. Please go ahead.
It's working now? Yeah, thank you. So good morning, everyone. I'm very happy to be here today and to present you my research. With the moving clinical trial landscape towards more decentralized approaches, we were really wondering, what does that mean for the patients? So how does that affect patients' willingness to take part in clinical trials? Do they either prefer conventional trials, hybrid trials, or decentralized trials? And how did we investigate that? We performed a discrete choice experiment, which is a common method in healthcare to elicit preferences. And we did so in 3 European countries, in the Netherlands, Austria, and Germany, with a total of 787 participants. And how did we set this up at DCE? In principle, in very easy words, you ask participants to make choices on a set of hypothetical choice tasks. And I brought you an example of one of these choice tasks that we asked our participants. Here you can see 2 options. These are 2 trial options. They comprise of different attributes with their companion varying degree of levels. And we also had option C, which is the opt-out. So if participants did not want to participate in either of the 2 presented trial options, they also had the option to opt out. And in our analysis then, we were interested in, okay, what are the average preferences in these countries? And we performed a mixed multinomial logit model. Now, coming to the results, we were looking at the relative attribute importance, and there we saw that relative to all other attributes, the safety and the efficacy of the drug was the most important attribute in all countries. This was followed by contact with the study team, number of scheduled contacts, and also the trial duration. And the activities that you need to perform yourself and the use of digital technologies, they were least important for the decision to participate in a clinical trial in all 3 countries. We were also interested in, okay, what are then actually, how do patients accept certain trial designs? And then we set up different hypothetical trial scenarios. So we designed a baseline clinical trial at site with 30 minutes travel, but also a hybrid trial combining home and site with 30 minutes travel. And we had 2 distinct DCT options. So one was a home visit and one was home with video contact. And then we looked into, okay, what are the acceptances in the different countries? And there, interestingly, we found that in the baseline clinical trial, we saw the lowest acceptance in all countries, and the highest acceptance we found in the DCT with home video contact. So in all countries, decentralization was preferred. And what you can also see here is that in the Netherlands and in Germany, the preferences were really driven by the trial design, whereas in Austria there was a strong preference for overall trial participation regardless of the trial design. But overall, decentralization was preferred. Thank you very much.